New Jerseyans, and both Senator Booker and I are incredibly proud and fortunate to have fellow New Jerseyans who are willing to share their compelling stories, and you'll hear from them shortly. We're holding this call because the next Supreme Court justice will likely determine the fate of the Affordable Care Act. My Republican colleagues are hell-bent on rushing this confirmation so that they can have a 6-3 conservative majority on the Supreme Court in time both for the November election and the November 10th arguments in California versus Texas. That case is a challenge to the Affordable Care Act brought by several Republican-led states with the Trump administration's support. Now, Republicans have been gunning for the Affordable Care Act for a decade now. I know I was here. I was part of helping to write the Affordable Care Act as a member of the Senate Finance Committee. And for a decade, I have listened to them talking about repealing the Affordable Care Act and supposedly replacing it with something, although a decade later, we still have seen absolutely nothing for which they have to replace it. They tried to repeal it and they failed. And now they're hoping the Supreme Court will do their dirty work because they still a decade later have no plan. If the court strikes down the Affordable Care Act, 20 million Americans, including 750,000 New Jerseyans, will lose their health care coverage. Protection for 135 million Americans with pre-existing conditions, including 3.8 million New Jerseyans, will be gone. Seniors on Medicare will see the return of the donut hole and higher prescription drug costs. Women can once again be charged more than men for their health care. And young people will get kicked off access to their parents' coverage. Health insurance companies could once again pose annual and lifetime caps on care, which basically means that if you have a major illness and you have a lifetime cap, there's a ceiling on how much the insurance company would pay. And after that, you're one illness away from bankruptcy. We eliminated lifetime caps under the Affordable Care Act. And they would no longer be required to cover essential benefits like substance abuse treatment, prenatal and maternity care, prescription drugs, or offer preventative health screenings cost-free. So it's outrageous that the Trump administration is engaged in this crusade against the Affordable Care Act in the midst of a global pandemic. As COVID-19 cases nationwide surpass 8 million, every single person who was infected now potentially has a new pre-existing condition. So I'm sick and tired of hearing Republicans talking points about how the ACA isn't really in danger. That's a damn lie. President Trump has already undermined the law and sown confusion with a slew of backdoor attacks. The number of uninsured Americans was growing even before the coronavirus reached our shore. And millions more have lost their coverage as a result of the president's incompetent and failed management of the pandemic and its economic fallout. A Republican victory in California versus Texas would be the straw that breaks the camel's back. It would undermine the integrity of the entire law and lead to rising costs for everyone. Let's be clear. Republicans know the American people oppose their morally bankrupt agenda. That's why Mitch McConnell no longer cares about letting the American people have a voice in the future of the Supreme Court. That's why we, the people, must make our voices heard. And I want to thank each of these New Jerseyans on this call who you'll hear from shortly for speaking out and sharing your stories. It's never simple to share about your personal health challenges, but we admire them in doing so. Before we hear from them, my great distinguished colleague, a member of the Senate Judiciary Committee, a tremendous champion since he came to the Senate with me on the Affordable Care Act and creating quality, affordable health care for all people, Senator Cory Booker.
To my senior senator, with gratitude always for his leadership, his commitment, his conviction to continue to do everything to fight for the well-being of New Jersey residents. This is a real powerful moment in American history. I just have joined my Judiciary Committee colleagues in not boycotting the committee markup, which is where they will vote Amy Coney Barrett out of committee to push it to the Senate floor for a final vote. We believe in one of those very important principles of non-cooperation with that which is wrong. We will not cooperate in them breaking Senate rules. We will not cooperate with them breaking historic tradition that in the last days of an election, you do not rush a Supreme Court justice aside. We will not cooperate with them violating the last wishes on her deathbed of Ruth Bader Ginsburg, who rightfully said for the legitimacy of the court, she believed that this nomination should wait until after the election, after the American people have spoken, that elected leaders should listen to the will of the people. And then Senator Menendez said, this is not an ordinary time. We are in the midst of a pandemic, the fourth largest mass casualty event in the history of our country, where millions of Americans are losing their jobs, losing their health insurance, and are recognizing the urgency in a pandemic of having access to care. We know what this Republican Party in the Congress has been trying to do. Dozens and dozens of times, a frontal attack trying to vote out the Affordable Care Act. And the last time they tried to do it in the Senate, we saw a number of Senate Republicans break with the party's will, break with this president and say, no, you cannot take away health care from millions of Americans with no plan whatsoever to replace it. And during that battle, we saw thousands of Americans, New Jerseyans up and down our state, having the courage to come forward and tell their personal stories, because this is not politics. It's not left versus right. Healthcare for Americans, the wealthiest nation in the world, having access to critical care. This is about what's right, what is morally right. The suffering of our fellow countrymen and women should not happen in a nation. People should not put aside prescription drugs because they can't afford it. People should not have pain or hurt in their body and put off seeing a doctor because they can't afford it. And so I stand with Senator Menendez in saying this end run that they're doing right now to put on a Supreme Court justice that has been openly hostile to the Affordable Care Act, as a case is coming to the Supreme Court that could violate our national will and upend the entire Affordable Care Act, putting millions of Americans out of insurance coverage. Hundreds and hundreds of thousands of New Jerseyans could say to people with pre-existing conditions, and remember, now if you've had COVID, that is a pre-existing condition, that such folks could be denied coverage again. That people who have been struggling with health issues their lives could be hitting that so-called lifetime cap of the past and not even be able to be insured anymore. These are the kind of horrors that should not exist in this day and age, and this is why we fight. And so I not only join with my judiciary colleagues today in saying we will boycott the hearing that's ongoing now, that we will not cooperate with this sham process, but even more so, I stand with Americans from all backgrounds, all ethnicities, all across the political spectrum, who do not want to lose their health and care, who do not believe that in a time of crisis, we should abandon those policies that help Americans have security, safety, and health. And so now I'm honored that we have a number of New Jerseyans who are humble heroes to me, who are willing to stand up and show vulnerability, to talk to their truth, to find really that common chord of empathy and decency within us all, to hopefully engage us all to act, to not just listen with our open hearts, but to act with a commitment that we cannot allow this to happen in our nation. Now, the first speaker lives near me in Newark, New Jersey, Stephanie Vicario. And I'm so honored because she is a 31-year-old pharmacy technician at an independent community pharmacy. She is there every day working to help people be better. She contracted COVID-19 in April and survived an extended hospital stay during which she was on a ventilator for over a month. Thank God for her health and for her making it through that dark shadow of the valley of death. Now, her hospital bill was in excess of $800,000 in claims. Her story is compelling, and I yield to her now to talk about her experiences.
Thank you very much, Senator. Good morning, everyone. As he said, my name is Stephanie Vicario. I'm 31 years old and a pharmacy technician at an independent community pharmacy. I was admitted to the hospital on April 15th, and I was diagnosed with COVID-19 pneumonia. In less than 24 hours, the doctors determined that they were unable to maintain my oxygenation level, and I was intubated. I was intubated for 33 days in total, after which I was extubated and underwent a tracheostomy. During this time, I was on a ventilator for 37 days. I spent a total of 47 days in the hospital, followed by 18 days in an acute rehabilitation hospital. On June 19th, I was finally reunited with my husband, who also had been sick with COVID-19. The major concern my family and I have with regards to the future of our health and healthcare insurance is, as the senator said, with COVID-19 being considered a pre-existing condition. Currently, my husband and I are enrolled in a healthcare plan provided through his employer. Our concern is that if the Affordable Care Act were to be struck down, that it would create the precedent for other healthcare insurance companies to raise our rates based upon both of us having COVID-19. An additional concern is if a lifetime maximum aggregate limit were to be put on claims paid by the healthcare insurance company. With my extended hospital stay, our current insurance provider has mailed us notices for claims in excess of $800,000. I'm sure I would have exceeded my limit. My final concern is actually for both my parents. They also had COVID-19. My father owns a small business, and he oftentimes has to switch healthcare insurance providers based upon the needs of his business, current rates, and coverage provided. If COVID-19 is considered a pre-existing condition, not only would my parents have trouble obtaining affordable healthcare coverage for themselves, but for their employees as well. Thank you all very much for your time.
Thank you, Stephanie, very much for sharing your story, and we're glad to see you're doing better. We're going to fight like hell to make sure that you don't have to worry about $300,000 or any other challenge like that. Our next guest is Daria Caldwell of Flemington. Daria lost her job during the pandemic, along with her healthcare benefits. She's depending on the Affordable Care Act marketplace to acquire affordable coverage, especially as she grapples with a cancer diagnosis. Daria, thank you for being here today and sharing your story. If you would just unmute yourself.
There we go. Thank you so much, Senator Menendez. I appreciate it. Yes, I have worked for nonprofit organizations for over 25 years, trying to make life better for those less fortunate than myself. And in April, due to the pandemic, as you said, I was furloughed, only 6 weeks later to be laid off. Within that time, I fell ill and was hospitalized. And initially, the doctors thought I had COVID, but it turned out to be acute heart failure, a raging skin infection, and osteoporosis caused by multiple myeloma, a treatable but incurable blood cancer. I am currently on Cobra, but that will run out after 12 months. The pain caused by the cancer, the side effects of the therapy, and the intense schedule of treatment makes it difficult for me to find work. I'm only 62 years old and I'm years away from Medicare. I am on unemployment, but that is due to run out shortly. So I have very little money to pay for expenses such as rent, insurance copays, prescriptions, transportation. And just to give you an idea, I'm currently taking a chemotherapy pill called Revlimid, which costs $713 per pill. And I take that every day. And the price is slated to increase again this year. because I have coverage, most of that through COBRA is covered right now. But in addition to the cancer diagnosis, I was born with a pre-existing condition. I had aortic valve disease that required several operations. The current prosthetic valve needs to be replaced. It's 41 years old, and I'm scheduled next spring, actually probably February, to have that heart valve replaced. It requires preoperative testing. Hospitals say it's extremely expensive, and in order to get the correct care for my particular condition, I have to go out of state to the Cleveland Clinic. Although my local oncologist and cardiologist treating me in New Jersey, the multiple myeloma specialist is located out of state as well. The ACA allows me the personal choice to find treatment outside my home state. That is what is best for me. Medicaid does not allow that, and because of the restrictive low income situation, I'm currently not eligible for that plan. There's a 16-month gap between the end of my COBRA insurance and Medicare. And without the ACA to use as gap insurance in between, I will have no medical or prescription coverage for nearly a year and a half before I can get Medicare. Even if some company does offer to insure me with pre-existing conditions, I am quite sure it would be cost prohibitive and I will be subject to lifetime caps. Without insurance, my cancer treatment would cost out of pocket nearly $58,000 per month and does not include any additional life-extending procedures such as stem cell transplant, which averages approximately $150,000 without the hospital stay. Does not include bone marrow biopsies, x-rays, blood work, all of that. If I have the good fortune to live 10 years, which is possible, if I had to pay out of pocket, it would come to around $7 million in medical costs. And because there is currently not a cure, treatment is ongoing throughout the lifespan. If I had the good fortune of living that long as many do, the costs would be astronomical, and even if they were covered or not subject to lifetime caps. This perfect storm of circumstances and the threat of losing the protections of the Affordable Care Act would be beyond devastating. Dissolving the ACA would cost me my life. That sounds dramatic because it is. I don't want to die, but I feel like a price tag has been put on my head. And the constant threat of will I or won't I have insurance is beyond anything I thought I would ever have to endure as an American citizen. Fighting cancer requires not only intense medical treatment, it requires hope. If the Affordable Care Act is abolished by the Supreme Court, I have no path to recovery ahead of me. My hope is gone, and that is nearly as devastating to me as the diagnosis itself. I thank you so much for listening to my story, and I will do anything to make sure that not just for me, but for all of us, all the millions of people that are affected by this possibility don't lose their lives. Thank you.
Thank you so much. Your story, Daria, has so many dimensions to it of why the Affordable Care Act is so important. Coverage, lifetime caps, ability to go out of state, choose your own provider. And we are not going to let you not have hope. No matter what the Supreme Court does, we will act legislatively. I hope the Supreme Court doesn't strike down the law.
Senator Menez, can I just add, because I have some doctors in my family, and we've had many conversations about what it does to live in a constant state of anxiety and fear, and how that complicates your physical medical conditions. And to have millions of Americans living in constant fear, the cortisol levels in your body, all of these things that are happening, it's just wrong that we should create that kind of anxiety for Americans. So Daria, thank you. That was so moving, and as Senator Menendez said, it touches on so many policy issues, but it also touches on issues of the spirit and issues of the heart that we should not be seeing with Americans, should just not be seen.
Thank you.
Absolutely. And I'm very familiar with Revlimid. It was a subject, a significant subject of my last election. So I understand what you're facing and the costs.
Right.
All right, let me turn to Scott Chesney of Verona, who was paralyzed from the waist down at age 15. The costs of his treatment and care are exorbitant. Without the Affordable Care Act, he would likely face lifetime and annual caps. And Scott also advocates for others with the Christopher and Dana Reeve Foundation. So thank you, Scott, for sharing your story.
Thank you, Senator Menendez, and thank you, Senator Booker. I speak for a living, and I speak from my heart. And listening to my extended brothers and sisters here on this panel brings me to a state of emotion because it was this week, and thanks to being invited to be a part of this panel, I dug deep and I moved to that place, and Senator Booker was talking about a little bit of fear. I took it to another level of desperation. And while I'm not in that place right now, I feel the pain working with so many people with disabilities, but I also went a little bit deeper. And I said to myself, wow, I have that pre-existing condition. I woke up to paralysis at age 15. I was an athlete in Verona and just woke up. I had a very rare stroke in my spinal cord, and it was just my time. So 35 years later, I sit in this wheelchair, and yes, there are highs and lows of living with a disability, but you know, aging with a disability is tough and your body breaks down. Just 3 months ago, I was doing a basic transfer from my wheelchair into bed, something I've done thousands of times, and my shoulder popped. And all of a sudden it was followed by excruciating pain. I have degenerative rotator cuff and labrum tears. And so I had to go to physical therapy. All these things, thanks to my wonderful wife, who works in a school system and has insurance now. She works full time in the school system. But before that is that she was an independent contractor at different schools. So we had to buy into the insurance, and then we had to move on to COBRA. And we would always examine, because it just, again, living with a disability knows no barriers. I know a lot of people who are watching this right now and say, wow, he sits in that wheelchair. He can't walk. And I wish that was as easy as saying that. But folks, every single day, and I know there are no two disabilities alike, there are no two MRIs alike. Every single day, I have to catheterize myself up to 6 times a day just to urinate, because my body doesn't respond to doing anymore because of paralysis. Every other day, I have to have a bowel movement, thanks to medication and thanks to drugs that allow me to do that. I sit here in this wheelchair, but I know as I age, and I'm hoping one day to walk away from this wheelchair, but as I age, I know there could be a day where I'm looking at this manual chair becoming a power chair, which is far more expensive. Folks, I don't do these things. I don't catheterize every day. Is that if I can't afford it, I don't live. If I can't have that bowel movement every other day, I don't live. For me, being able to get in this wheelchair and move freely about this wonderful country that we live in, that's peace of mind. That's giving me some type of purpose in life, which this wonderful world, this country has given me the opportunity to do. I don't have that wheelchair. I'm not doing this. I'm not doing this. So I moved to a place of desperation, and I'm so thankful that I did, because while I'm not there myself now, I know my extended brothers and sisters with disabilities who don't know how they're going to pay for the next medical treatment, who are sitting at home right now in excruciating pain because they may not know in the future what the future has in store for them. But I really wish that everyone understood that nobody, from the moment they're born to the moment they die, can say to themselves, I am not going to have a disability. I wish that was the case, but it's not the case. And as we live longer as human beings, is that degree of separation between us and someone, maybe a loved one, maybe a friend, maybe a colleague living with a disability, is getting smaller and smaller. This is not a segment of the population we can ignore. It can't be at that point where something happens to your family where you take notice. We take notice now because these are our extended brothers and sisters who we need to care for. We can't allow this to happen, because we have to go on. We're all connected. We're all connected, and we need healthcare. Thank you.
Thank you, Scott. Thank you for a very compelling story and your advocacy of everybody in the disability community. And we're moved by your story. And thanks so much for sharing it with us. Let me turn to Angie Tyson Dixon, who lives in Camden. She has epilepsy and gets her insurance to the Affordable Care Act exchange. Angie, what does the ACA mean to you and your family, and what would happen if it's taken away?
First of all, let me say thank you for having me, Senator Menendez. It means a great, great deal, life or death. I am epilepsy. I have petit mal seizures. I take up to 3 pills a day, Tegretol. My medication costs $450 just for 90 pills if I did not have this insurance. So without that, I can have up to 15 seizures a day. You know, speaking on that, my children's father, he also has the insurance. So he's on dialysis. His kidneys is failing. Without that, he will no longer be on the donors list. If he passes and I pass, who will my children have? You know, like Scott said, unfortunately, my mother passed last year on Mother's Day due to obstruction, you know, because she didn't have insurance. Just, but it was a little too late, you know. So if we don't have this insurance, people will die. So we do need Affordable Care Act. Thank you.
Thank you, Angela, very much for sharing that story. And this is another example why it's critical, not just for our individual citizens who are talking today, but their extended families as well, why it makes such a compelling case. Next is Morgan Thompson from Roselle. Morgan helps people recover from substance abuse at Prevention Links in Elizabeth, a center I visited in 2018 to announce more federal funding to combat New Jersey's opioid epidemic, something that Senator Booker was a champion with me on. Morgan is also in recovery and can speak to what's at stake for people struggling with mental health care, addiction, and other related issues. Morgan?
Thank you so much, Senator Menendez and Senator Booker, for having me and for your advocacy on this issue. Again, my name is Morgan Thompson. I'm a person in recovery from a substance use disorder. I'm one of the lucky ones. I'm someone who found recovery, and it's made it possible for me to be a part of my family, to be a wife, a mother, to pursue my education, and to establish a career where I can help others to find and sustain recovery as well. But it's not a matter of luck. It really isn't. It's a matter of the fact that I had treatment and resources available to me that enabled my recovery to be possible. Without those life-saving supports and services, I more likely than not would have been one of the 70,000 Americans whose life is lost to overdose each year. I want to share about the fact that in my early recovery, I faced a possible loss of insurance coverage as a young person that would have cut me off from the life-saving supports that were keeping me stable in my recovery. But because of the Affordable Care Act and its dependent coverage requirements, I was able to remain on my parents' insurance with no interruption until the age of 26, when I was out of school and had a career and was able to obtain insurance on my own. Our young people, like myself at the time, 18 to 25-year-olds, are disproportionately impacted by the addiction crisis and by behavioral health conditions in general. And the dependent coverage requirement of the ACA makes treatment possible for many of them. It makes recovery possible for many of them. More broadly, as a professional working in the behavioral health field, I've witnessed firsthand the impact of Medicaid expansion here in the state of New Jersey. What that looks like for people with substance use disorders, well, when someone reaches a point where they're willing to seek help and access services for their addiction, it's a very small window of opportunity that opens, and it usually closes very quickly. Prior to Medicaid expansion, people seeking treatment for substance use who didn't have private insurance faced wait times of days, but typically weeks before a treatment bed would become available. And in those days and weeks without support, people would continue to use because they didn't have the support they needed. And oftentimes they would more often than not really, they would lose the motivation to seek help. That window of opportunity would close. And in some cases, they would overdose and die while waiting on a treatment wait list. And this was a tragically common story prior to the Medicaid expansion. It still happens, but it's a lot less than it was before, but it would certainly be, the status quo again if the ACA were to be repealed. Medicaid expansion has also increased access to long-term recovery support services for people with behavioral health conditions. We know that when someone, in the rare case that someone does receive treatment, they're not cured. They need ongoing support, and Medicaid expansion has made that so much more possible than it was previously. And just to kind of wrap up, the opioid epidemic isn't over. We're in the midst of the COVID-19 pandemic, and the two are colliding in a really dramatic way. We're seeing increases in substance use, increases in overdose deaths and suicides since the pandemic started. And this is just the beginning. The psychological effects of this pandemic will continue to fuel the addiction crisis for months and years to come. So I think it's really important to understand that for millions of Americans to lose their health insurance under these circumstances is simply irresponsible. So it is my hope that that won't happen. Thank you so much.
Thank you, Morgan. Thank you very much. And for not only the challenge that you seem to be facing very successfully, but helping others as well in doing so. So thank you for sharing that story. Our next guest is Judy Merotha, who is the president of Now New Jersey and a leading women's rights advocate. She has her own personal story with how the ACA has helped her and her family. Judy.
Thank you, Senator Menendez and Senator Booker, for this opportunity to share our stories. It was in 2014 that I started to experience abdominal pain. At first, my doctor and I both thought it was just menstrual cramps. But as the year went on, the pain became debilitating. It interfered with all my daily activities. I was eventually diagnosed with severe or stage 4 endometriosis. There is no cure for it. There are 3 options for somebody diagnosed with it: to live with it and manage pain through painkillers, to have invasive surgery to remove the uterus and surrounding tissue, or to manage the symptoms through hormone regulation. Managing the symptoms and pain is done through the use of what is commonly known as birth control pills. These are actually man-made forms of 2 hormones, estrogen and progestin. And it is estimated that somewhere between 30 to 60 million American women rely on these pills to manage their pain. The Affordable Care Act was the first time that coverage was mandated for these pills by insurance companies. Preliminary studies have shown that there may be a hereditary component and that Asian women are twice as likely to develop endometriosis than white, Black, or Hispanic women. So it's not surprising that both my young daughters have it as well. For women who want to have a family someday, surgery is not an option. So the only chance that they have of living a normal, pain-free life is a regimen of so-called birth control. So while in college, my daughters were able to stay on our insurance, and because of the Affordable Care Act, have access to the medication that they needed. Calling it birth control politicizes the medication, and we have already seen a rollback of that coverage mandate by the Supreme Court in Burwell versus Hobby Lobby. But if we only recognize that there are millions of women who take these pills, these medications, for reasons other than contraception, we may not be having this conversation at all. My daughters are young, and now they have a pre-existing condition. I worry that without the ACA, they will be denied coverage someday. If at any point they have an employment gap and lose insurance, no insurance company will be ever required to pay for their medication again. As president of the National Organization for Women of New Jersey, the passing of Justice Ginsburg and the resulting sham of a nomination feels like our worst nightmare come true. Not only did we lose a trailblazer who fought for our values of equality and equity every day, we are now faced with a replacement who stands for dismantling all the progress that we have made in this country for women's rights. This Supreme Court and the cases before them could strip us of reproductive rights and health care for all women. This is about women having control of their body, their health, and their ability to make medical and reproductive health choices for themselves. And we will not stop speaking up. So thank you again.
Thank you, Anjali, and thank you for your advocacy. Thank you for sharing the story and how this affects women in a way beyond the common arguments that are made on the question of contraception, that there are other medical purposes, and certainly how it extends to our children, in your case, their daughters. So thank you very much for sharing it with us. Cory, you want to introduce our next guest? You have to unmute yourself. Yeah.
Thanks, Ben. I still need you to be helping me through this.
Okay, Gloria Nieves. Gloria lives in Newark. Are you aware of this, Gloria?
Yes.
Another person that lives close to me, and Gloria, I'm grateful for you being on and just looking forward to hearing your words.
She works part-time and doesn't get health insurance through her employer. She also has some pre-existing conditions. So it's good to see you, Gloria, and Cory and I both thank you for sharing your story with us.
Hi, everyone. Thank you for having me. I'm a 49-year-old young woman who is a type 2 diabetic, but with the pre-existing condition of asthma. And this little thing here, I have to walk around with for the rest of my life, averages out to $74 a month. Without this, I can have an asthma attack and not be here any longer with you fine people. And this one right here is for my diabetes twice a day. And this averages out to $199 a month for 60 tablets. And that's only a month because it's 2 days, twice a day. I don't know what I would do without that. I am a part-time. I am fortunate enough to have a job that I can work from home. I'm able to help the women that I work with. And I'm fortunate, as I hear all the other New Jerseyans on this call, I hear their stories and I feel very fortunate that I'm not in their predicament. So God bless you all for, trooping it out. But, it worries me. It worries me if we don't have the Affordable Care Act, what will we do? I work as a community doula in the Sister to Sister Community Doula Program of Essex. And I hear a lot of my women, the women that I help and I assist and that my colleagues assist, I hear them, their bills. Without the Affordable Care Act, they wouldn't be able to afford prenatal and labor costs. That's worrisome. That's worrisome because if the woman can't get prenatal care, we're back to square one. It just ties all together. Without the Affordable Care Act, we would be lost. And where the hospitals will be closing again because everybody wouldn't be able to afford the bills, or the charity care will have to pay out. No, so it's very important that we keep our Affordable Care Act. And for all of my fellow New Jerseyans that are here, God bless. For everyone on this call and around us, God bless you all. Thank you for having me on this roundtable, and we need to keep fighting for our ACA, definitely. Thank you so much.
Thank you, Gloria. Thank you.
Thank you, Gloria. Everybody should be able to fulfill all of their God-given potential, and what you have to take to be able to do so and perform a tremendous role as a doula is something we want to make sure can continue to happen. Our final guest is Judy Rosenstein from Edison. Judy and her husband are on Medicare, but what folks always seem to forget is that the Affordable Care Act closed the so-called Part D donut hole that made prescription drug costs too expensive for many seniors. If the ACA is struck down, many seniors like the Rosensteins will see their prescription drug costs skyrocket. So Judy, thank you so much for sharing your story.
Thank you. Can you hear me?
Yes.
Okay, hi, I'm Judy, and this is my husband Abe. And between us, we have a ton of illnesses, but thank God we're here and we're doing fine. I'm a two-time cancer survivor, and I have pre-diabetes, diabetes, and my husband got a kidney transplant 4 years ago, and thank God he's doing very, very well. And the drugs that we have to take to maintain our health can be costly. I take these 4 medications every day. This particular one, Forxiga, is $100 a month, but I'm a former New York City teacher, so I have coverage, but with the coverage, it's $100 a month. My husband, Abe, has to take, when do you take your drugs?
Once you finish.
He takes his drugs,
Yeah, just, I'll go.
a couple of times a day, and again, we have to pay some co-payments, but some of them are manageable. When he first got out of the hospital after the transplant, which he got from a living donor, and did wonderfully, but he's going to talk about his drugs after transplant.
So I was diagnosed with kidney disease about 10 years ago. Just kept getting worse, and then finally I had to go on dialysis for a year, and then a wonderful man who I didn't know donated his kidney to me, and it worked out great. But when you get a kidney, it's a foreign invader in your body, and your system wants to attack it. So you need immune suppressant drugs. And when you leave the hospital, I don't know if you could see this, but they gave me a sheet like this. These are all the drugs that I would have to take, to combat this. There's a lot of antivirals, antibacterials, bacterial drugs, immune suppressant drugs. So some of the drugs, I don't remember all the prices, were $700 a month, $500 a month, and that's with coverage. Those were the co-payments. So so worked out okay for me. I'm doing fine, and right now the trouble is I'm doing fine because I'm on Medicare, and Medicare helps subsidize the immune suppressant drugs. But there are other people who aren't on Medicare, which Medicare covers for 3 years for them, and they've told me they have to make a choice after the 3 years whether to pay for the drugs, to pay their rent, or to eat. And many of them were leaning to eating and paying their rent and hoping that they would survive without the drugs. But if they didn't take them, they would go back on, they would lose their kidneys again. They'd have to go back on a transplant list. And just finally, the COVID virus set people's immune systems into overdrive. And the immune systems were attacking anything it could in the body, the lungs where you couldn't breathe, the heart, and it particularly attacked the kidneys. Many people got COVID with perfectly healthy kidneys and now are on dialysis. So I'm speaking for them. There are thousands of people on dialysis who were never on dialysis, who now are on the kidney transplant list, looking for kidneys, and they will need all these medications themselves, and we really have to protect them as well. Thank you.
And when I was an in-service teacher, I applied for catastrophic insurance, but I was denied simply because both of my parents were type 2 diabetics. I wasn't diabetic at that point in time, but I was denied the access of getting this catastrophic insurance, which would have been very helpful with those expenses, but it's a terrible, terrible thing. So the ACA protects consumers from insurance companies, driving up prices, shenanigans in general, and it's 1 in 9 people in this country is at risk of developing kidney disease through high blood pressure. It's a huge, huge problem, and we feel we have to speak out for those without a voice. And thank you so much. Thank both of you senators for what you do for our state. We're so grateful for all your hard work and speaking for the underdog, those without the big bank accounts, and just doing what's necessary. But keep up the good work, and we're here for you in any kind of support that you need. Thank you so much.
Well, thank you, Abe and Judy, and we're glad to see you're both doing well. And another compelling dimension as to why this is so important. I think all of you have made the case of to why the Affordable Care Act is so important, far more powerful than the eloquence of my colleague Cory Booker or the experience that I've had in helping to create the law. We really appreciate you all sharing your stories, so many different dimensions, and we all take courage from the way that you're meeting the challenges that you have. So I think with that, we'll open. We've had the press listening to these stories so that they can understand why it is that we are so focused about the question of the Affordable Care Act. I think you've all reminded us what's at stake in this nomination vote, what's at stake in terms of the law, and Cory and I would be happy to take a few questions.
Thank you, Senator. We now have some time for some questions from the press. Members of the media wishing to ask a question can use the raise hand feature on Zoom. Okay, we have a question from Julie O'Connor from the Star Ledger. Julie, you are now unmuted.
Hi, can you hear me now?
Yes.
Okay, great. What would you say to some of the Republicans running for Congress in New Jersey who are saying that they would protect people with pre-existing conditions? Do you find that believable?
Well, we have already protected people with pre-existing conditions by virtue of the law, something for which there was no protection before the law. So I would say to them, why are you supporting the president and the Republican efforts to strike down the law that is already protecting people? And in addition to that, doing all the things that we just heard from all of our fellow New Jerseyans. I feel that that is a fig leaf for them in terms of trying to cover with the consequences of the law being struck down. You know, for a long time, they enjoyed the politics of trying to say, oh, this is a terrible law, we can do better, we would replace it better. Well, a decade later, they have not shown what they could or would do. And so now they have been unmasked for what it is, which is a truly just pure, naked partisan attempt to strike down a law that ultimately gave millions health insurance, millions more pre-existing coverage that did not, pre-existing conditions, protections that didn't exist before, and all the things that we've heard, Medicaid expansion, greater affordability of drug prices. I find that it's pre-existing condition protection is one thing. This law is about that and so much more. And Cory, I don't know if you want to join in that.
No, you said it well, Bob.
Our next question comes from Michael Diamond from Gannett. Michael, you are now unmuted.
Michael?
Oh, hi, can you hear me?
Yes.
Does that work? Thanks. If the law is struck down, how will the Democrats respond? And could you rewrite the law that would satisfy the legal challenges?
I'll answer that. I think this is why this election that's ongoing right now, in which many New Jerseyans have already voted, but this election really will answer that question. We must win back the presidency and replace a president who has tried in every way to repeal the Affordable Care Act, who's put forth no plan of his own. And we must replace Mitch McConnell in the majority leader position. If we do that, the two people who have really been the principal architects of ending the Affordable Care Act, of their efforts to end the Affordable Care Act, we can then have a lot of options with which to right these wrongs, including passing and expanding healthcare for Americans. It's what Joe Biden wants to do, and everything from driving down prescription drug costs by letting Medicare negotiate and taking other responsible actions, to expanding Medicare to lowering the age in which you qualify. There are a lot of things that Joe Biden has talked about, legislation that Senator Menendez and I have worked on. But the precondition to that happening is this election. And so this election, again, to me, is not about right or left. It's not about Democrat or Republican. It's about, do we want to have health care for a country that is expanded to cover those who are rapidly losing their health care? Or should Donald Trump and Mitch McConnell be successful, should be back into that world where insurance companies got to dictate to you whether you had insurance or not, or deny you coverage. So there's a lot at stake, but the only way we're ever going to overcome the challenges that Republicans are presenting is if we get out there and vote and create a government that will respond to the kind of compelling, heart-aching stories that you've just heard from my friends that are on this call.
Our next question comes from Jonathan Salant from New Jersey Advanced Media.
Thank you for doing the call. We've heard, and Senator Booker, you did that at your at the hearings. We heard from other stories of New Jerseyans who have been affected by the ACA, who now can get insurance and coverage because of pre-existing conditions. And now we have another set of stories, but it seems to do nothing in the Senate. What's the idea? What's the benefit of having a call like this? And do you think this at least will put pressure on voters or get voters to come out even more to support, lawmakers who want to keep the ACA?
I'll go quickly and then let Bob, if he wants to add as well. But when injustice is being done, you cannot be silent. You cannot be silent. That is complicity. That is aiding and abetting the tragedy that we see being foisted upon the American people. So one, we must always speak up against injustice. We must always speak out for our fellow Americans, fellow New Jerseyans who are facing crisis and fear and potentially losing life-saving medications or health coverage. Number two is we want to build momentum. We want to call this out as a rallying cry that mobilizes more people. Number one, to make the moral appeal. We still have a possibility of 2 Republican senators changing their position. We saw that when they tried to repeal the ACA in the beginning moments of Donald Trump's term. We saw a Republican of good conscience join two other Republicans to stop this. So that's still a possibility. I don't want to give up that sense of hope. But number two, we want to make sure that people are motivated to vote for their health care. and that's something that's really important to me, because I know American history. There have been wretched, horrible things done in the past, but we have shown an unbelievable ability to turn those wretched chapters into pathways for redemption, to correct, to right wrongs. And I'm hoping that this is the momentum that we get in the coming days in the midst of an ongoing election.
I would just add to what Cory said is that, look, for most of my life in public service, I have had one constant refrain, is that elections have consequences. And this set of incredible human stories magnifies, creates a dramatic and prescient, clear reality as to what's at stake in this election. Elections have consequences. I join Cory's hope that some of these stories and others that are being generated across the country will move the hearts of some of our fellow Republicans to stop the nomination. But in the absence of that, if that's not to be the case, then we need majorities and a new president who will help write a new version of the Affordable Care Act that will provide all of these protections, that will even go further, and that we believe can be written in a way that would not be struck down by the courts. That's what's at stake. And these stories, I think, tremendously, powerfully add to the fierce nature of why now in this election is so important. Next question.
Our final question will come from Zach Cohen from the National Journal.
Hi, thanks for doing this call. I really appreciate it. I wonder, after this morning's hearing where Republicans advanced Judge Barrett's nomination without Democrats present, whether either you two or any other Senate Democrats plan to raise a point of order on the Senate floor objecting to that advancement in contrast to committee rules.
Bob, let me just, if I may. So there are going to be a lot of things that I think we're going to do. We're not going to foreshadow them, though, in the media right now. I think that, again, there's a determination to exercise as much as we can the procedural rules, as well as moral outrage, frankly. So I think that you're going to see a lot of members going to the floor for various reasons to try to stop this from happening. And remember, if it happens, it's going to be a matter of days before election day. But we don't have an election day in this country. We have an election period. And so I think that this is going to look more and more absurd. And I think there'll be a lot of things we do to call out that absurdity. Again, as I said earlier, we will not sit silent as what we think is, and believe, as many Americans do, one of the darker moments in the modern history of the United States Senate.
With that, on behalf of Cory and I, let me thank all our fellow New Jerseyans for sharing their incredibly compelling stories. And I think we're deeply moved. And you add fuel to our energy in terms of knowing what we're fighting for in real terms. So thank you so much. It's never easy to share personal health stories. And so we're deeply in debt to all of you. And we're going to continue to fight. Make sure all of you are healthy. Cory?
I just want to just concur with your sense of gratitude, Bob. There was the people who participated today. Their stories were compelling. Their stories were just plain honesty, and more powerful, as you said, Bob, than anything you and I could say. So I just want to thank them for being here, and just affirm to them that as they continue to fight, their two United States senators will be putting one hell of a fight up in the remaining days before this election, and obviously, God willing, in many days afterwards, to make sure that every American, every single American, I know Bob and I will not rest, has access to quality, affordable health care, and not the kind of fear and anxiety and hurt and pain that comes about with this broken system in which Republicans are trying to undermine that very aspiration. So thank you, Bob, and thank you, everyone.
Thank you, everyone. Stay safe, stay healthy.
Thank you.
Thank you. Thank you.
Thank you.
Thanks, everybody. Bye-bye now. Scott, shave your head, man.
Thank you.
If Abe can shave it, you can shave it, man.
He
Abe,
does it himself.
proud of you, Abe.
When you win, I will shave.
Don't make promises. Don't let your mouth make promises that your head doesn't want to keep.
I didn't say when I was going to shave it, though.
Take care, everybody. Thank you.
Thank you, Senator Booker. Thank you so much.